More than 1 crore people suffer from COPD every year in India. So, it becomes very much important for us to know about the disease. COPD is also called as chronic obstructive pulmonary disease, which is preventable, first of all, and treatable lung related disease. People who suffer from COPD find it difficult to breathe and often feel tired because they have breathing issues. Sometimes COPD is also referred as chronic bronchitis or emphysema. Now let's come to the common causes of COPD. The major risk factor for COPD is smoking. Apart from active smoking, other factors that can also cause COPD are irritants, second-hand smoke, chemical exposure, or people who are engaged in workplace where the fumes exposure is too much. Plus, if you're in your urban population, you will find the smoking is one of the major cause of COPD. But you will find in rural population, then chula or hookah smoking is one of the major cause of COPD. So you can imagine how many COPD patients can be there and they are not being treated or they are not aware about the disease. So this makes this video more important. So now we will know how does COPD affects the lungs. So when we breathe, the air travels from our windpipe into the bronchial tubes, and from bronchial tubes air goes into the small air sacs which are called as alveoli. They are grape shaped in structure. The alveoli are elastic and they are flexible, helps us in exchange of the gases between the blood and the lungs. So when the air enters the air sac, they expand and contract while exhaling. In lungs who have developed COPD, these bronchioles and alveoli get damaged, leading to excessive mucus production. And the damaged alveoli also hampers exchange of the air. Both of these conditions leads to breathlessness or difficulty in breathing. So we should also know what are the symptoms of COPD. The common signs and symptoms of COPD, the foremost one is shortness of breath, which is also called as breathlessness, dyspnea, and it happens while doing everyday activities. Initially, this breathlessness will start when you do a task, when you have to climb on some hill, or maybe have to walk on the stairs or climb the stairs. Then gradually, at rest also, this breathlessness becomes severe. This is the severe COPD. So make sure when you start feeling breathlessness and you are a smoker, you should think about it and consult your doctor. Constant coughing or wheezing, sometimes called as smoker's cough, which I am aware many of the people who are smokers and watching this video must have developed smoker's cough. But they will call it this is smoker's cough. This helps in removing all the secretions. But I think this is the time you should stop smoking and ask your doctor or consult your doctor and take the proper advice. Chest tightness or inability to take a deep breath, recurring respiratory infection because of breathing issues, loss of energy, and an acute exacerbation of COPD, sometimes a blue haze around the lips, or nail beds can be seen, which is called as cyanosis, unintended weight loss. And if you are a smoker and experience any of these issues, it's time to consult a lung specialist. The doctor may ask you to do some tests like chest x-ray, spirometry, in which they will check your lung functions. Based on your symptoms and the condition, medications is prescribed to the patient. The medications can be in terms of bronchodilators, which are mostly inhaled, which helps in opening up the lungs, plus some oral medications to remove the secretions, to help out exhaling of or expectoration of the secretions. Third is breathing exercises, which helps in making your air go inside properly and to come out properly. If you have any questions with respect to COPD, let me know in the comments.